Okay, great. So, hi everyone, happy to have you here this afternoon. And just it's going to be a very quick session, 15 minutes, with hopefully good recommendations and ideas to take from it. I'll just start presenting my screen. So we're discussing in the next 15 minutes, the detection of health threats through health surveillance systems and social media. And I'm Hayek. I am a non-resident fellow with the Tahrir Institute for Middle East Policy. And today I'm presenting this talk. You can all get in touch with me on my Twitter account. And let's just start without further ado. So I know surveillance might sound a bit weird and might be a scary word for people in the sphere working in data privacy and rights, but in terms of public health surveillance is actually a very good thing and something we need more of. So debunking the health surveillance is something very important. So the health surveillance is actually just kind of surveying the population, but in terms of health status. So knowing what do I have in terms of my population, in terms of country level mostly, or maybe on smaller levels, maybe hospital level, maybe area level. It depends on the country and the different government or legislation there is there. But basically knowing what's going on with this population to be able to have interventions, activities, and to be able to design a healthcare system that would support my population to be as healthy as possible. So we could have something as registries, which we do have. For example, in Lebanon, we have a cancer registry where we can find the number of patients we have on cancer on a yearly basis. There is also registries on the flu, for example, and this is very common for the flu to be present in other countries. We do have maybe data collection on a hospital level and so on. So there's different types that I'm not going to go into, but just here saying that you shouldn't be scared of the word surveillance when we're discussing health surveillance. And then going to the second part of my talk is the fact of data. And how data is now just almost all around us and interacting with us more and more, and how during this COVID-19 pandemic, we learned the hard way the need for data, the need for timely data, the need for real time-based data, the need for now data, the need for digitized data and digitized system that could allow us to collect the data quickly and efficiently to be able to quickly respond to this pandemic and respond to the health threat that we were facing, and not being more passive and waiting for like the data to accumulate, which we didn't see in our Arab countries. Few Arab countries have such digitized healthcare systems, or let's say health surveillance systems, where they could collect data quickly, efficiently, and of course respecting all data privacy rules and regulations, to be able to respond to it. And we've seen this with the slow response of many of our governments to the COVID-19 pandemic, and thus the devastating consequences we had in terms of death, morbidity, and people, hospitals being flooded with patients, and nurses and doctors not being able to respond to this. In another way, if we think of it, again, data is really much all around us. And I think we had today earlier a talk about calling about open data, because not only because it's very much around us, maybe the talk was more about accountability, but also I would want to stress about the concept of open data, just because it's almost all around us. It's present everywhere, and we don't have to go search for it sometimes. Like maybe we think we would need to, for example, in research studies, or where we would need to collect data, talk to someone, register, do the questionnaire, or have a session with the person and do a discussion or an interview and register it. But really, if we think of it, data is just very much all around us. We're bred, fed, and we live on data these days, from just entering our information when creating an account to any maybe e-commerce site, or even maybe to sharing our information with our physician when we go and visit the physician if I want to take the healthcare system. So it's really pretty much around us. And the access to data is very essential, especially during crisis time. and very much stress on the health crisis and the COVID-19 pandemic. So the access to the data by everyone is very essential, even though this data, our government might hide around the fact that this data, we're protecting you. It's more on data privacy, but no, there's a lot of data privacy rules and regulation that can allow us to access data in a safe way, if I want to say. So the importance of having access to the health data that could help us, again, take a step and do intervention and be proactive when reacting to the crisis in front of us. Now, what I want to talk about is more of, as we said, the data is all around us. We have public health surveillance system that we might think of, collecting data on a population level and going through this data on a more of a traditional level. But if we think of it, because data is all around us, this does create sources of non-traditional data, or I will call them non-traditional epidemiological sources, because I'll discuss this more from a scientific perspective and how we can leverage these sources and using them in reacting to health crisis and facing health crisis and detecting early on health crisis. So these non-traditional sources are mostly everything we have around us, from social media data, maybe Google search trends data, as well as other data present on platforms. I would say Reddit, any other platforms, WhatsApp, any data that we could leverage in a way and use for, I would say, good purposes, scientific purposes, rather than using them for purposes that is not for the good of all. This is an example, if you can see here, this is just an example of one of the very few studies done in the Arab region on a Twitter data set, where they looked at the attitude of people in tweeting in Arabic, I would say. It's just a period of 12 weeks, and they did just more of looking at the frequencies of the words that were mostly appearing in this. And you could see like China was very much appearing in those tweets. And you had, of course, other words. But this is just to say the power of these sources being non-traditional data sources that would help us to detect many things, would help us to detect health crisis early on, maybe detect, and we will see an example later on, and of how COVID or other viruses spreading were detected early on, but also detect other things happening within the society during these crisis time and these very interesting and changing times, such as an example here, the attitudes. What were the attitudes of people in the Arab region to the outbreak? And as such, government should be leveraging this very useful, and I would say it's a treasure. I mean, they should be leveraging on this to be able to intervene. Maybe, and this is just a speculation here and an example, having the China word here maybe was trying to create some sort of racism towards these people, but I mean, they were not. So it would help us also to face this. Another example is this Google search trend. This is a study that I personally worked on. And if you remember, almost a year ago, we had back then President Trump, saying that you need to take bleach to be able to not have COVID and to be able to be cured from COVID. And we went on with a group of researchers and looked at the Google search trend of people looking at, injection using bleach, disinfection using bleach, and so on, right after this. And you could see this huge peak that would tell us that people were actually thinking that they should be doing this. It was showing us a behavior in a way, not only an attitude, but a behavior. And we had put this data in parallel with basically the calls that were happening to the Poison Control Center in the US, and we saw also a peak in those calls. Again, these data were obtained, and of course, getting those data is, of course, anonymized, so we don't know who are the users mostly, because it's through API. So just to mention that, and we wouldn't know. We just know what's happening in it. And finally, going back to the fact of how we could detect health threats, and going back to the fact that in our region, there's a lot of things going on. There's conflicts, there are economic crisis, there are political crisis, and we know that social media has been very much leveraged during the past couple of years to be spreading the different movements going across our region. I would say more political, but we should be thinking that social media also could be leveraged to detect the health threats facing us and other crises facing us. So, for example, just really much an example in Lebanon, early on in the summer, we had somehow of a mini outbreak of food poisoning cases. However, there was no words from our Ministry of Health talking about it, and there was not a lot of actions taken. But if you go on Twitter, you would see everyone tweeting about getting a food poison at this place and at this place and at this place. So people were able to know which places to go to if they wanted to eat out or not. Again, how social media is a powerful tool for that. And it comes to this final slide in my talk, and the fact that the European Center for Disease Prevention and Control had actually created a tool that would allow us to scientifically detect early warning of public health threats using Twitter data. And I mean, this is only Twitter data, but we could try to replicate this model for other social media data. And this tool has been actually very much proven efficient and effective at detecting these threats, and it allowed to detect multiple threats compared to the normal ways of detecting those threats, like, for example, like how we do, we collect the data or we learn about it and so on. But people are very much connected nowadays, are very much on their social media, and are very much, just very on real time transmitting the evidence, transmitting the information. So we should be trying, again, leveraging this fact that we live in a very kind of now type of society, and try to also use this to have early warning for the multiple health threats we will be facing in the future, because there are not going to be any less. And I think with that, I'll end my talk, and I'm happy to take any questions from the audience. Okay, if no questions from the audience, then I think we are right on time to finishing up. And I would thank you all for attending this afternoon session after such a long day. And I hope you're all enjoying the conference. And we'll be seeing you around, I guess.